Role ambiguity and lack of respect, contributing factors to workplace fatigue. Fatigue is a state of being physically and emotionally spent. It is the body's way of telling us we need to rest. Workplace fatigue is fatigue that happens as a result of the demands and environment of the workplace. In the literature concerning role ambiguity and lack of respect among allied health professionals, the term most often used is burnout. Burnout and fatigue are not the same thing. Burnout consists of emotional exhaustion, depersonalization, and lack of personal accomplishment. Fatigue is only a part of burnout and is represented by the component of emotional exhaustion. Emotional exhaustion is characterized by physical exhaustion, the feeling of being overstretched, and the inability to unwind or recover. For the purposes of this presentation, we will be looking at burnout research while keeping in mind that fatigue is only one part of burnout. Role ambiguity is best described as unpredictability of performance consequences, a deficit of expected role behaviors, a lack of knowing the actions required in a position, and a lack of professional identity. Some of the causes of role ambiguity are lack of information regarding scope of responsibilities, unclear expectations, unclear or outdated policies, gap filling, and struggling to define professional identity. Gap filling is when a professional defines their job not by what they do, but by what the other professionals don't do. When this happens, the underpinning theories of the profession are not being used. Lack of respect is the term used in the literature that refers to the idea of having to provide constant justification for service provision, interventions used, fees charged, or decisions made, or the repetitive process of explaining what you are doing to someone who is skeptical, does not care, or does not understand. Occupational therapists may feel a lack of respect when they are trying to convince a health insurance company to provide coverage for therapy, or when their manager doesn't understand why they don't visit patients with depression in the morning. The literature tells us that healthcare payers demand justification of interventions and that having to justify our roles is a contributing factor to fatigue. The literature also tells us that occupational therapists have difficulty explaining their role to others and that not being able to define our role puts us at a higher risk for stress and fatigue than other professionals. Meet Lisa. Lisa is an OT working in an inpatient geriatric rehabilitation clinic. She works on a multidisciplinary team consisting of a doctor, a nurse, a social worker, a physical therapist, a dietitian, and a recreation therapist. Her program is constantly being redefined depending on funding and the political landscape. Lisa's patients always think she is a nurse, while the families think she is a physical therapist. With the most recent change to her program, Lisa isn't sure what is expected of her. And with so many professionals on her team, Lisa has trouble finding her niche as an OT. Her FTE zero point 0.8 has been reduced to zero point 0.6 because management does not see the need for occupational therapy, and the doctor leading the team does not understand why Lisa needs to do home visits before discharge. Lisa is experiencing role ambiguity and lack of respect, which can lead to workplace fatigue. Here are some steps you personally can take to deal with role ambiguity and lack of respect in your career. The first step is to use coping strategies like seeking social support from networks, mentoring others, and engaging in professional development. The second is to deliberately use occupational language. Try replacing the word function with occupation in your workplace. In one study out of Australia, occupational therapists found that using occupational language significantly increased their understanding of their role as an occupational therapist and made it easier to explain to others. Third, ask for an updated job description if you aren't sure what your role is. This can help reduce role ambiguity in situations where programs have changed. Lastly, support SAOT, your professional advocacy organization. SAOT's role is advocating for occupational therapy to government, insurers, and the public. The more we support them, the better job they can do educating people about occupational therapy, thereby reducing the confusion and skepticism OTs face in the workplace every day. In addition to being an advocating partner, SAOT also offers professional development opportunities, social support networks, and mentorship programs. You can check out their website at www.saot.ca. You can use your flexible spending account to pay for professional development expenses, which removes the financial barrier of enrolling in the programs you would like to take. The collective agreement set out by Health Sciences Association of Alberta stipulates that job descriptions must be available in the workplace for employees.